Hi, I'm Rebekah.
And I'm Sabrina.
We're at Therapy Playground, and today we're talking about the differences between the home and clinic environments for therapy. Sabrina, can you tell us a little bit about the home environment when you're doing therapy?
Typically it varies for each child and each therapist. Some are more structured, some are more laid back, and it's usually revolved around the child, what the kid wants to do, what toys they want to play with, and their goals. So if it's gross motor, we might go outside and play. If it's fine motor, we'll stay inside and do little activities with that. So it's a lot less structured than what I believe how the clinic setting goes. Also, the kid really enjoys having someone come into their house. They feel like it's their personal teacher and they get their special one-on-one time.
So that's a lot different than therapy in the clinic, where you have a more structured environment. You can sit the kids down in a chair at a desk, and you can work with them that way. A lot of times the parents are not present during therapy in the clinic, and they may actually have a harder time incorporating the strategies that we use in the clinic setting into their home environment, because we're not in their home and they don't see us doing that in their daily routine. So we are a lot more structured in the clinic, and are probably able to get a lot more out of the child or the patient, just as when it comes to targeting the goals and actually looking at the goals very specifically in the clinic versus in the home.
In the home, the parents are usually there. They sometimes are involved, and that's completely okay. We want you to be involved. You can be involved in the activities. If there's a sibling causing distraction, sometimes I'll pull the sibling in to engage in the activity with the kid, and we encourage parents to continue these activities in your daily routines. It might not be specifically that activity, but encouraging them to use, certain words that we've been working on, or activities that you can engage with your kid, like counting when you're going up and down the steps, or just anything in your daily routines to encourage your kid on the goals we're working on.
Yeah, and like I said, it's when the parents are not present in the clinic setting for therapy, it's a lot harder for them to see what we're doing in the therapy setting and apply it to or listen to what we say after the therapy session. Like, I may go out to my parents 5 minutes earlier or before the session is over and discuss with them what I did with their child that day, and say, these are the types of things that you need to be working with your child on at home. This is what you can be doing. But because they're not in the therapy session, and also because the therapy is not taking place in the home, it's a lot harder for them to maybe grasp how to do that, because they're not actually seeing it hands-on, and they don't have somebody in the home actually, like I'm not in their home actually showing them this is what you need to do.
Would you allow a parent to come back and watch you?
Yes, absolutely.
All right. Well, we hope you learned something from our podcast today. If you want to know more about Therapy Playground and what we provide, please go to www.therapyplayground.com. Thanks.
Thanks.